There's an interesting story that is revolving around Americans being misdiagnosed. The number is staggering, according to three separate studies. 12 million people in America are misdiagnosed every year. Let's learn a little bit more about this from Dr. Gerald Edelman, who is an oncologist, an author, and speaker, and a member of the American Society for Clinical Oncology. Dr. Edelman, how are you, sir?
Good morning. How are you doing?
I'm doing very well. What's your take on these three studies?
Well, first of all, I think that it's something we need to pay attention to. We always want to get better. On the other hand, we want to balance that with calmness and kind of reevaluate relationship with your doctor. So my take on it is have a good relationship with your primary care doctor. I think that works both ways. Like you said, I practice oncology. I've been in practice over 22 years. So we have a system set up where if we order a test, my nurse and I talk, and we make sure we call the patient, and we make sure that we discuss the results, and we make sure that the patient understands the results. And my own system for trying to tackle these the mistake issue is I often ask the patients to come in and talk to me eye to eye about a test result. So that does two things. Number one, it makes sure that I'm picking up everything I'm supposed to pick up. Number two, it continues your relationship with the patient. You're looking eye to eye. So I think it's a two-way street, and it's a partnership. That's the way I think your listeners should view their relationship with the healthcare system. The danger with a study like this is making, an antagonistic relationship. We don't want to do that. So that's my advice, my take on it.
Researchers from Houston Veterans Affairs Medical Center and Baylor College of Medicine calculate that more than 5% of all patients are misdiagnosed as a result of doctors failing to follow up on red flags for cancer and other serious illness. And what I've just learned from you, Dr. Edelman, something we've heard from other physicians, we really need to take ownership of our own health. And if we have any questions or concerns, we got to follow up on those, get second and third opinions, and do our homework.
I agree with you, but in the spirit of cooperation and not antagonism, one thing that I'd like to tell your listeners, when you're dealing with the healthcare profession, staying calm and developing good relationships and not antagonistic relationships, I think really helps with the medical care. But I do agree with you that should be a dynamic a relationship between the two, the provider and the patient. So yeah, take an active role, but make sure it's like any other relationship, that it's a cooperative, caring situation, and that you got a doctor that you have good chemistry with. I tell a lot of folks that feel bad and guilty about leaving a doctor, don't feel guilty. You've got to have good chemistry, just like in any other relationship in your life.
Are you seeing a challenge with hostile type relationships or relationships where doctors are having challenges with their patients?
Well, I've seen it in my 22 years in practice a lot, but I will tell you, I think one of the biggest challenges we face now in our society is there are pressures on physicians and providers to decrease cost, which will actually force underutilization of some of our wonderful technology, in my opinion. So these economic pressures to not test are going to go neck and neck with the pressures to diagnose. So again, I think patients need to be advocates for themselves and I can't emphasize this enough, you have to have a good relationship with your family doctor. A lot of these misdiagnoses are folks that don't have necessarily primary care, maybe going to the emergency room with a symptom, and then, they don't have an established person that they have a relationship with, and so there's no follow-up. So there's a lot of that type of thing out there as well. So establish a good relationship, take a dynamic part in the relationship, and a cooperative one, not an antagonistic one. And I think that makes things go smoother.
We've been talking with Fox News Radio's Dr. Gerald Edelman here on 1320 WILS. Dr. Edelman, thanks so much.
You bet, and a real joy to be on with you this morning.